So this is going to be the axial skeletal system vertebral column, starting on page 65 of your outline, of your lab manual. All right, so let's get started looking at the entire vertebral column. So the vertebral column are a series of bones separated by intervertebral discs. They are discs of fibrocartilage, as you should remember from chapter 3. The intervertebral discs absorb shock and they help to provide a joint for movement of the vertebral column. You might notice that the vertebral column is not straight, but it has curves to it, right? So the curves help it function more like a spring rather than a rod. So it helps you absorb shock as you step, jump, absorb shock as you move around in the world. So the bones originally are to provide protection for the spinal cord, but also attachment sites for ribs and also for muscles of the neck and muscles of the back. You are actually born with more bones than you have as an adult because bones will fuse. About 5 or so bones to fuse to form the sacrum, and then you have a few more bones fusing to form the coccyx. So let's look at the curves. So this curve here, we'll take a bigger picture. We have the concave curve, so this curve is concave. Okay, then we have a convex looking from this direction, right? So it's a little, if it's like this, that forms a indentation, a dent, then that's concave. Then we have a convex, we have the opposite curve for the thoracic region. Then we have a concave curve again in the lumbar region, and then a convex curve again for the sacrum and coccyx. So the first 7 vertebrae are in the cervical region. They're called cervical vertebrae, and they're named after their number. So you name them C1, C2, C3, C4, C5, C6, and C7. The next section are the thoracic vertebrae, and there are 12 of them, T1 through T12. Then the next area is lumbar vertebrae, L1 through L5. An easy way to remember this is the mnemonic: I eat breakfast at 7, lunch at 12, and dinner at 5. I used this a lot when I was first learning anatomy. The sacrum is approximately 5 fused vertebrae, the coccyx approximately 4 fused vertebrae. The coccyx is a little bit more variable in people. Sometimes people have 3 fused, 5 fused, it just depends. The sacrum is a little bit more fixed. All right, so let's take a look at the general features of all vertebrae. So this is, we're going to go through the list here. All vertebrae have these structures except for C1. C1 is a little bit of an oddball, but everything else should have these structures. So transverse process is the first term, and these are processes that stick out to the side transversely, right? So the transverse processes, for the most part, they're going to be in muscle attachments. In the thoracic region, they're going to also articulate with ribs. Then we have a spinous process. So the spinous process is going to be the bony projection that points posteriorly, and you can feel these bumps if you can move your fingers down the, your vertebral column in the back. The projections you feel, those are the spinous processes. The body, right, is this nice flat area that's going to where the intervertebral discs are going to rest. The lamina is going to be a connection point between the transverse process and the spinous process. Oh, trying to change colors here. It's not working with me though. Oh, there we go. All right. So the lamina is going to be this area here. Okay, so there's 2 areas considered our lamina. And then we have our pedicle. So our pedicle is, again, a piece of bone that's going to bridge the body with our transverse process. So right here. So these areas are really important because you can say, oh, I fractured my left pedicle, or I fractured my right lamina. Then you know exactly where we are on the bone. Then we have the vertebral foramen, which is pretty obvious. We have a nice big opening. You should know that the spinal cord runs through this. And then our next column, we have superior and inferior articular facets, superior and inferior articular processes. So now these vertebrae are going to articulate, or the word articulate means form a joint with, right? So articulate or form a joint with the vertebra above it and the vertebra below it. So we're going to have a process that sticks up so we can touch the vertebra above it. That's going to be the superior articular process. And then there's going to be a region of the bone that articulates below. And for some areas, it's kind of flat. And for some other bones, it's a little bit more distinct. But in this picture here, we have some thoracic vertebrae. It's this inferior region just looks like a little flat area. Now, what's the difference between a facet and a process? A facet is a smooth, flat area, okay? And so the facet is going to be just the smooth region that I sort of make the lines on. The process is the whole bone, okay? So it's the whole part of bone that is going to stick up and form that, oops. So if I were to circle this whole thing here, that's my entire superior articular process, right? This whole entire thing is my superior articular process, but just the flat area is the superior articular facet. All right. So anyhow, that's the distinction between the two. You guys can cross out the superior and inferior vertebral notches. I don't cover the notches. And then the intervertebral foramen are formed by the superior and inferior vertebral notch. So let's take a look at this picture. Notice how when you stack a lot of vertebrae together, that you create an opening, this hole here. So that's your intervertebral foramen. Those are where your spinal nerves exit the spinal cord and reach out to innervate different parts of your body. All right, so those are general regions of the vertebra. We're going to move on and look at the different regions of the vertebral column, and you're going to need to recognize the characteristics of each type of vertebra, a thoracic vertebra versus a cervical vertebra versus a lumbar vertebra, okay? So this is just a nice picture here looking at our spinous processes. Note that the spinous processes face inferiorly, right? So they all kind of point down. If you were in class and you had one of these in your hand, you would want to hold the vertebra so that the spinous process faces inferiorly as much as possible. If you held it the opposite way, you're holding it upside down. All right, so let's start with the cervical vertebrae. So we're going to look at C1 first. C1 is a very unique looking vertebra. It is completely circular and there is no body. Okay, there's no flat area. What I'm saying is there's no body like that for C1. So C1 has, let's go down the list for C1. So C1 is also called the atlas. Both terms are acceptable in an exam. It's named after the god here who holds the world on his shoulders. And so C1 is the bone that your skull rests on, which is why the world on your shoulders, right? It's the atlas. So remember that the part of the skull that rests on C1 is the occipital condyles. So the occipital bone, those nice round condyles, are going to rest on your superior articular facet. All right, so let's go on and move through the list. Posterior tubercle instead of a spinous process. So a tubercle is a little bump. I like to think of tuberculosis because tuberculosis is bacteria in your lungs making tiny, tiny bumps. And so tubercle is a tiny bump. Oops, sorry. So this is your posterior tubercle. You also have an anterior tubercle, as you can see here. Okay, so you have two tubercles. The posterior tubercle is slightly larger. And then you have two arches, right? You have an anterior arch. So the bone that goes across like this is your anterior arch. And the posterior arch is everything that goes across like that. Okay. The facet for the odontoid process. So I'm going to look at this term down here and notice on the inside of this bone there is a flat facet. So this is for, or you can also say facet. Okay, so you might note, let's go to this picture. So this is C1, all right, and this is C2. And notice that C2 has a bony projection that comes up like this. This is called the dens. And this forms a pivot joint. So when you shake your head no, this is what the C1 can rotate around C2. So the facet for the dens is actually right here behind that anterior arch. So coming back to our first picture, right where my arrow is, that's where the dens would rest, and that's the facet for the dens. All right, that is what's unique about C1. Now I'm going to say that all cervical vertebrae have transverse foramina. So this is something that you should highlight in your notes as something to look for if you're given a vertebra and you're asked what region of the vertebral column did it come from. Is it cervical, thoracic, or lumbar? Because only, let me point to it here, only the cervical ones will have a hole in their transverse process. So it's a baby transverse process. It's not a bony part that sticks out very much, but it is making the effort. So it is a process that sticks out transversely, and we see a hole in there. That hole is to allow blood vessels. It's called the vertebral artery and vein, runs through there. It enters your skull to help nourish your brain and then drain the old blood away. All right, let's take a look at C2. So C2 is called the axis because it has that dens. This is the special thing about C2. So the way that and I think the easiest way to look at this is when they're put together, but C2 has all the normal parts. It has a spinous process, it has transverse processes, even though they're really tiny, really doesn't stick out very much at all, but it's still considered a transverse process. We still have a transverse foramen, we have a hole, we do have a body on one side. On the inferior surface there's a body, but on the superior surface there's that dens. So let's take a look at it in this fashion. So this is how it would look anatomically, right, except that you would have intervertebral discs between the two. So here's C2. So what's unique about C2 and the rest of your cervical vertebrae, well, I should say, C2 through C6. They all have this bifurcated spinous process, which is called bifid, okay? So notice how the spinous process is split. That's unique to C2 through C6. All right, so I think we did enough on C1 and C2. We located all the things. This dens here, this slide is just mentioning that this dens can be actually a dangerous anatomical feature if your head is jerked violently forward or backwards. So if your skull is driven inferiorly, backwards towards the spine, the dens can be forced into the brainstem, causing death. If your neck is jerked forward, like in a car crash, the dens may be driven posteriorly into the cervical spinal cord, which is also fatal. So really violent movement of your head is not good. And this is, one reason or one way that you could possibly have a fatality from that movement. All right, so this is our classic cervical vertebra. So this is a really good image to know because it has all the characteristics of most of the cervical vertebrae. So it has this transverse foramen, right? This hole does not appear in any other vertebra. And it has this bifurcated, split spinous process. Other features that are a little bit lesser, they're not as yelling out at you or screaming out at you, is that the vertebral foramen is a triangle. So you can see the shape of this is a triangle. And the superior and inferior articulating processes lie in an oblique plane. So that means that this structure that touches the vertebra above it, right, that superior articulating process, it's kind of at a slant. It's at an oblique plane. All right, C7 is a special one. C7 is called the vertebral prominens. So if you're looking at the top of page 66, C7 is, let me just take a look at it, right? Look how long that spinous process is. It's very prominent, right? That's why it's called the vertebral prominens. And it also does not have a bifurcated spinous process. But you can feel this. This is a very easy one to feel on your body, and it's used by clinicians to locate the, so you can be sure that you've located C7, and then you can feel up and down counting from C7. So if you were to, look down, you could probably feel C7 at the base of your neck. All right, so the thoracic vertebra, what makes a thoracic vertebra unique is that it's going to attach to ribs. So the vertebral column, you have 12 pairs of ribs and 12 thoracic vertebrae. So rib 1 articulates with thoracic vertebra 1. Rib 2 articulates with T2, and so on and so forth. So, well, until, so on and so forth. So we all have these facets or facets for the ribs, showing where the ribs contact the thoracic vertebra. So the first blue term in your list is superior and inferior costal facet. Superior is, so these are both on the body. So here is our superior costal facet, and here is our inferior costal facet. So the word costal refers to rib. When we look at the rib next, we'll see that there are costal cartilages, costal grooves. So costals means rib, like how much do those ribs cost, not coast. Okay, sometimes people write coastal. That's not it. So this is your superior and inferior costal facet. Then we have a transverse costal facet. So here on the transverse process, we have another flat area for that rib to touch. Okay, so that's what makes the thoracic vertebra unique. Other features that make it unique, and I think are really easy to spot, is this very long, inferiorly pointing spinous process. Very dramatic, long, inferiorly oriented spinous process. That's characteristic of thoracic vertebrae. You can also see from another view that the vertebral foramen is nice and circular, right? That's also characteristic of a thoracic vertebra. And that's it. Oh yeah, and then the superior articulating facets are facing the frontal plane. So if you're looking, it's kind of like, remember if this is the front and back or anterior, posterior, the frontal plane is, or the coronal plane is going to be straight down. So this is giving you a high five, so it's in the frontal plane. Some students like to look at the vertebra like this, think it looks like a giraffe, and it does kind of look like a giraffe, and that's a clue as to whether it's a thoracic vertebra or not. Okay, so we've done that thoracic vertebra. Now, these are different thoracic vertebrae. So this is T1, this is the first one, this is T7 in the middle, very classic thoracic shape. T12, when we get to the last thoracic vertebra, it looks a little bit like a lumbar vertebra because we can see that the spinous process has changed shape. So you don't worry, you're going to get a very classic image on any sort of assessment that you're given. All right, moving on to the lumbar vertebra. So the lumbar region is going to be the thickest and strongest 5 vertebrae of all of your bones. The lower back or the lumbar region is going to really have all the weight of your torso before it hits your hips. So the lower back is taking on a lot of weight, and that's what makes lower back problems extremely common. The vertebrae down here are not as flexible as the vertebrae in the thoracic region, and so sometimes you can move in a way that pulls the alignment off, or you can slip a disc, but this region of the back is very vulnerable to injury. And if you never have lower back problem, congratulations, that's a really great thing. But it's very, very common, so that area. Let's look at the lumbar vertebra. So the pedicles, the lamina, and the body are thicker and more massive than the other ones. The vertebral foramina are triangular, so we're back to a little bit of a triangular shape. Okay. The spinous processes are short and blunt. So that is actually what I like to look at when I look at the vertebra. I take a note that it's very large, and then I look at the spinous process, and it is a nice square hatchet-shaped blunt spinous process. So very characteristic of lumbar vertebra. The other ones is the superior. I also look at this. The superior articular process looks like curved. It's curved in. So Mickey Mouse ears a little bit. So they're facing inwards. So this and this, they're facing each other. It's hard to see in a two-dimensional image, but it's cupped in. So that way, when it articulates with the inferior, take a look at their inferior articular facet, it's curved out. So we're going to, it's kind of like you take your hand and you put your hand on your forearm. That's how they fit. And so it makes a very good fit for a lot of stability in this area, right? So lumbar vertebrae are very stable because of the way they articulate with each other, but that stability means it's lower flexibility. You'll find this flexibility in a lot of the bones, right? If the bones fit together very, very well, it's good for stability, but not good for flexibility. So there's kind of an inverse relationship between the fit of bones and how much flexibility you have at that joint. All right, so some students like to look at this and think it looks like a moose as a clue as to whether or not it is a lumbar vertebra. All right, so this is just a quick quiz. What region of the vertebral column did this come from? This is cervical. All right, why? Because I have a bifurcated spinous process and I have a nice transverse foramen. I also have a really beautiful triangular vertebral foramen. What region is this vertebra from? And it's lumbar. And the reason is because I have a blunt, square, hatchet-shaped spinous process. Look at, this is a really good image for that curved, cupped-in, superior articulating process. Notice how it's curved like the letter C, and they're facing each other, right? So, and then take a look at that inferior articulating process, right? That's drops down low, and it's curved as well, but in the opposite direction. Back to a triangular vertebral foramen. Next, what region is this one from? This one's our last choice. It's thoracic. So let's look for those classic thoracic features. This very long, inferiorly pointing spinous process. We also have costal facets, right? Those flat areas that touch a rib. So remember, they're on the body. There's two of them on the body. There's a superior one. So let me just say that even on a real vertebra, these are very difficult to spot. You kind of have to look for them. And sometimes they're really small. So this area is a flat area. If you look down here, for the inferior one, I can see a little flat area here, right? So those are my two. So this would be the superior costal facet. This is my inferior costal facet. And then here is my transverse costal facet on the transverse process. Okay, this guy here is my superior articulating process. So here again, there's a difference between process and facet, right? The entire bony part that sticks up, this is the superior articular process, but the flat area I can see here, that's my superior articular facet. And notice how these superior articular facets in this image, they're facing you. They're facing the back of your body, kind of like they're giving you a high five. So that's facing the frontal plane. Another feature is this nice round vertebral foramen. Okay, so we are done with the vertebrae. This is a nice little comparison chart that you can look at if you want. I'm going to skip it and talk about the sacrum or sacrum. So the sacrum is continuous with the vertebral column, and it has features that relate to it because these are 5 fused vertebrae. Okay, so they're going to remain, there's features of the sacrum that are going to be remnants of the vertebrae. So let's start with the median sacral crest. So the median sacral crest is a ridge that goes down the midline of the sacrum, and that is a fusion of the spinous processes. Okay. Then we have lateral sacral crests. So there's another ridge that goes down laterally, and those are the fusion of the transverse processes, right? I'm scribbling here, the transverse processes. All right, now let's look for the auricular surface, the third list in your list. The auricular surface, the word auricular is ear-like. So somebody thought the lateral sides, the sides of your sacrum here, looks like an ear. So I'm going to outline the auricular surface. Notice as the auricular surface is smooth, right? The rest of this bone is really bumpy. This is the part that is going to articulate with your hip bones. Your hip bones are called coxal bones. So it's flat and smooth because you're going to have a little bit of cartilage there, and you're going to have a joint between those bones to form the sacroiliac joint. All right, so that's your auricular surface. You can cross out ala or wings. It gets confused with another term. Let's look at the sacral canal. So the sacral canal is going to be the opening here, right? So remember that this is a vertebra, so this was basically the vertebral foramen here. So we are going to have a continuation of nerve fibers going down into this canal. Let me just skip ahead to the sacral hiatus. So we can find the word hiatus in the last column of your list, but let me point it out here as well. So there's another opening. There are 2 openings for the sacrum. So all of this middle region is hollow, and this hiatus is going to open up. So nerves will run through the canal, and some will exit through the hiatus. Others will exit through these holes, which are the sacral foramina. Okay. All right. Let me just. All right. Well, I can't erase anything. All right. So now moving on to the transverse lines. So the transverse lines of your sacrum are on the anterior surface. So this is also called the pelvic surface because this is the bone, this is the region that faces your guts. It faces your pelvic cavity. And the transverse ridges or transverse lines are here. Okay. Sometimes you can make one out here. But those are going to be where the bodies of the vertebrae fuse. Okay. What about the apex? The apex is the point at the end of your sacrum. The base is going to be just the entire superior part of the sacrum. The base contains the body. So let's go back to this picture here and look at the word body. Oops, sorry about that. Trying to change some color. Let's erase some of these things. So if we look for the word body, we'll see the word body here, and we see the word body here. But the body is going to be the body of a vertebra. So if you looked at this from the superior, if you look top down, it would look just like the body of a vertebra. So it's round, flat area. The body sticks out. You notice how the edge of the body comes out a little bit. That's going to be called the sacral promontory. So the word sacral promontory is in the last column of your book, and it's indicated here. It's the edge of your body, and it's going to jut forward. So it's prominent, which is where the word promontory comes from. All right, so back to our third column. We talked about the body. We talked about the sacral foramina. That should be pretty easy. It's just the opening. So those are all sacral foramina. If you look at the sacrum from the anterior surface, as we are here, the anterior view, we call those anterior sacral foramina. If we look at the sacrum from the back, we can call them posterior sacral foramina. So just depends on how you're looking at it. Again, the next term is pelvic or anterior surface. So just to take a look at the back, so this is our posterior view. Right, here's our posterior view. It's very bumpy. We have our median sacral crest indicating where the spinous processes were. Then the anterior view is going to be looking at it from the front. So here's the back, very bumpy and ridgy, and the front is very smooth, right? So we're going to have the smooth part facing your organs. You don't want any bumps or ridges. Those bumps and ridges are where muscles and tendons would attach to. Now, in the last column, we talked about the hiatus and the promontory. You can cross out the word sacral tuberosity. And the last term in the list, sacral cornua or horns, those are going to be here. And it's just a bump. It's just the very last bump on the edges of your hiatus. Okay, so that's your sacral cornu. Cornu is sort of an old term for horn, so you can say sacral horn. All right, and then in terms of, so that's it for the sacrum, and then the coccyx is 3 to 5 vertebrae fused. Don't worry, there's no feature of the coccyx. We're not going to have those, but do know that the coccyx is slightly mobile. So the joint between the two, there does exist a joint, and it is slightly mobile. It is more mobile in women who are pregnant, because the women who are they produce a hormone that sort of relaxes your joints. It's actually called relaxin, and that can be pushed a little bit out to accommodate childbirth. All right, so we are done with the vertebral column. So let's move on with the thoracic cage and finish up the axial skeleton. So let's start with the sternum. So the thoracic cage is going to enclose the entire thoracic cavity. So it's going to protect your heart and lungs. When you think about the thoracic cage, most of you guys will think about the ribs, and that's a really huge component of the thoracic cavity. The ribs are going to articulate the thoracic vertebrae in the posterior body, and then anteriorly, many of the ribs contact the sternum. So the sternum is known as your maybe chest bone or breastbone. You can see the position here. The sternum has 3 parts to it, which is the manubrium is the upper part. Then we have the body, which is the second part, and we have the xiphoid process as the third part. So the manubrium has 3 regions, or actually just two regions that you want to do, 2 landmarks. So the jugular notch is here, just a nice little notch here, and you can see in my image here that you can see very well that jugular notch of her sternum. And then we have 2 clavicular notches on the sides, because your clavicles are going to contact and articulate your sternum at this point. Okay, so 2 clavicular notches. In the body, or the gladiolus, you're welcome to say body, there are facets for the ribs 2 through 7. So rib 1 does not contact the sternum here at the body. So we can see how we have little flat areas for the ribs. The xiphoid process or xiphoid process is just the last portion. There is a joint here, and there's also a joint here at the sternal angle. So when you inhale, your sternum has some mobility to it to lift up, and the bones can actually move a little bit differently or separately, slightly. But this little guy is an anchor point for your diaphragm when you breathe. So it's very important. When we get to muscles, you'll find the diaphragm has an attachment there. Now let's look at the ribs. So when we look at the lab manual, we have 12 pairs of ribs, so 24 total. The first 7 ribs are called true ribs because they attach to the sternum with this costal cartilage. They are directly attached with the costal cartilage. The 8 through 10, the next few ribs are going to be attached to indirectly, so they're called false ribs. They fuse together and then they attach to the sternum with a single attachment. And then the last ribs, 11 and 12, do not attach at all. So let me just say, they don't attach to the sternum at all with costal cartilage. They're floating. You can see them here and down here. And those are called floating ribs. So the last two ribs are both floating and false. All right, so I have 5 false ribs because the last two are included. They're floating and they're false. Okay, so let's take a look at the general terms or general structures of a rib. So ribs, I'm going to skip this and just look at the picture. Okay, so a rib is going to be a nice curved bone. It's considered a flat bone. The head of the rib is going to contact the thoracic vertebra, the body of the thoracic vertebra. So take a look at this picture here. Here's the head of the rib. The neck is a narrowing portion, right? So here you see the neck. So the head is the end, the neck is the narrow portion, and then you have another tubercle. And that tubercle is going to contact the transverse process. Then the angle of the rib, just like the angle of the mandible, is just a sharp turn in the bone. And the rest of the bone is going to be the shaft of the rib. Okay? So looking at your features, the next is going to be the costal groove. And the costal groove is a groove that you find on the inferior aspect of the rib. And you can see that groove, a slight indentation, and that's for blood vessels and nerves to travel along that rib and innervate or supply the muscles in that region of that rib. Okay, so that's all your terms for the general features of a rib. All right, so this one contains a little bit more than we talked about, but A would be the head of the rib, D would be the neck of the rib, B is another bump, and that's the tubercle of the rib. A sharp turn in the rib would be the angle, and then F, we can see F is going to be the groove, so that's our costal groove. Then we have the rest of the rib will just be the body of the rib, and then H has become cartilage, so this is going to be costal cartilage. All right, so don't worry about letter E. All right, and that's it.